A drug-resistant and potentially deadly fungus is spreading across the U.S. with cases right here in Wisconsin. Good evening. I'm Maria Lizignoli. Now, the CDC recording more than 8,000 clinical and screening cases last year in 28 different states. NBC 15's Colton Molesky spoke with local officials about how they are staying on top of this fungus. Colton?
Maria, the fungus Candida auris is the type of rare yeast infection. This fungus, spreading rapidly across the country, is drug resistant. But thanks to some very hard work by health professionals, DHS says there have been just a few cases here in Wisconsin.
Candida auris is a multi-drug resistant form of yeast.
Cases of the Candida auris fungus were reported in just 4 states in 2016, jumping to 28 last year.
This is generally something that is going to affect those who have complex medical conditions, who are on a number of medications, have a lot of long healthcare stays.
Healthcare Associated Infectious Program Director for Wisconsin DHS, Ashley Dowdle, says it is a serious infection because of how rare it is, but is not generally something posing risk to a healthy person.
It's generally not going to have any telltale symptoms that indicate to a physician that this is Candida auris. It would generally be something that is identified once there's a culture taken.
Dowdle says DHS has recorded just 7 cases in Wisconsin since January of last year. She says the Wisconsin State Lab of Hygiene is one of 7 CDC-funded antibiotic resistance laboratories, which offers screening practices, DHS communicating with hospitals to track cases.
This is actually something that we at DHS have been working with for a number of years. We'd actually had some messaging and work with our hospitals in 2019.
In a statement, Unity Point Health Meritor added to the case tracking, quote, the lab auto-uploads diseases they track, then hospital infection prevention staff see them in our surveillance data.
And then we're following up directly with those facilities that are affected and working through risks and doing screening to make sure.
Now, I'm told transmission takes place via first-person contact with someone's bodily fluids, which is why those exposed are typically healthcare workers, people who are generally healthy and would be unable to transmit the fungus. In the newsroom, Colton Molesky, NBC 15 News.